Question of the day. What questions do you need to ask when verifying benefits? Before we talk about benefit verification, there's a little bit of pre-work we want to have in order. So whether you're an in-network provider or an out-of-network provider, and you're providing benefit verification, you must have written permission via an insurance release form from your client before you can access their benefit information. And you most especially need this information if you're going to submit claims to the insurance company on behalf of the clients. Again, that applies whether you're in network or out of network. Also, as healthcare providers, again, our network status doesn't matter here. We have a legal responsibility according to federal laws related to insurance fraud. So our ability to verify the identity of the individual receiving services or authorizing services in the case of a minor. So one easy way that we can do our part is to ask for a copy of a photo ID. You also should always be securing a copy of the front and back of the insurance card if you're an in-network provider. It's literally in your contract. A quick thank you to TherapyNotes, our EHR partner and sponsor of the Question of the Day series. TherapyNotes is rated as the #1 EHR among therapists. It's robust, it's user-friendly, and it's affordable. So head on over to therapynotes.com and use our community code MIMH and try TherapyNotes for free for 3 months. All right, so let's tackle benefit verification. Ready? So there's a few questions that you always want to verify or to obtain information, whether you're using the 1-800 number, the automated system, or your provider portal. So you want to verify the following information, starting with, does the client have mental health benefits? Yes, still, this is a thing. Verify that you are submitting the mental health claims to the right payer and that a carve-out isn't involved. And if it is, you know what carve-out you're dealing with. You also want to confirm the mental health benefit information applies to in-office or telehealth, whichever you're providing. We know that there have been some differences or some exceptions. You want to ask if the deductible, if one applies to mental health benefits. Just because they have one doesn't mean it applies to our services. You also want to ask if there are any COVID-related cost-sharing benefits in effect. You want to request a link to this writing in policy. A lot of these are going away or already have gone away. Are there any policy exclusions? Sometimes there are exclusions related to things like adjustment disorders or couples therapy. You want to ask. Always verify the effective dates of the policy. This is also helpful if you're checking the deductible resetting. If you're providing telehealth services, you might consider asking if telehealth is required to be performed via a specific telehealth vendor like Teladoc or NDLive. Always document the name, date, and reference number. If possible, ask them to fax you a copy of the benefit verification or download it from the provider portal. I hope this was helpful for you. If you have a question you'd like us to tackle, head on over to masteringinsurance.com, and on our homepage, there's an Ask a Question button in the top corner there. If you're not in our Facebook community, Mastering Insurance for Mental Health Professionals, go ahead and join us there. All right, you take good care.